This is not my mother's menopause.
This is not my mother's menopause.
This is not my mother's menopause.
Hi, I'm Laura, your host for the series This Is Not My Mother's Menopause, What You Don't Know About Menopause, Hot Flashes, and Night Sweats. This series is about menopause and how it affects women, especially when symptoms of hot flashes and night sweats start. This is the last segment of a 6-segment series focusing specifically on the diagnosis, treatment, and management of menopause. In the previous segment, we heard from healthcare experts and guests about some of the stigmas and misconceptions associated with menopausal symptoms. We also heard about the importance of having the support of family, friends, and even coworkers during the menopause transition. In this segment, we'll hear from our healthcare experts and guests about current treatments for menopausal symptoms, as well as brand new remedies that will hopefully be FDA approved and released into the market in the near future. Before we hear from our experts and guests, let's first talk about what menopause is.
So what is menopause? A clinical definition of menopause is the natural end of women's menstrual cycles due to a decline in the production of estrogen and progesterone hormones in women. In other words, it's nature's way of ending a woman's monthly menstrual cycle and her ability to get pregnant. You may have heard the terms perimenopause and postmenopause. So what is perimenopause? For most women, perimenopause happens in their 40s. Perimenopause begins several years before menopause. So for many women, this will happen in their 40s, but for some, it can even begin in their 30s. This is the time when ovaries gradually begin to make less estrogen. As estrogen hormones rise and fall, periods grow longer or shorter, and women begin to experience menopause-like symptoms. Menopause naturally occurs in women between the ages of 49 and 52. But the age women experiencing natural menopause can also vary widely from 40 to 58 years old. It also varies by ethnicity. Postmenopause is the time after a woman has been without a menstrual period for 12 months or 1 full year. During this stage, menopausal symptoms typically decrease or stop completely. The symptoms of menopause usually develop in the transition years. The most common symptoms are vasomotor symptoms, or VMS. Of those surveyed, 40% of women report feeling hot or cold. 17% experience night sweats. 16% say that insomnia is a symptom of menopause. 13% of women experience vaginal dryness. Mood disorders affect 12% of women in menopause. And 12% of women also report weight gain during menopause. In all, 85% of postmenopausal women have experienced a symptom in their lifetime. VMS are the most common symptoms associated with menopause, affecting more than 50% of women ages 40 to 64. The most frequently experienced menopausal symptom among whites, Hispanics, and African Americans were VMS. And among Asians, it was decreased sexual interest and increased joint and muscle discomfort. According to studies, Asian women experience the smallest number of symptoms, and African American women experience the largest number of symptoms compared with other ethnic groups. Of those surveyed, 53% of African American women were more likely than white women, 29%, to have experienced VMS. Factors associated with VMS included race, BMI, and dietary intake of fat and calories.
To share with us her knowledge on current and future treatments for menopausal symptoms like hot flashes and night sweats is Janet Carpenter. She is a distinguished professor at Indiana University School of Nursing who has been studying menopause for 25 years.
When I think about treatments for menopausal hot flashes, the image that comes to mind is a campfire in the middle of the forest. And when you're standing on the edge of the trees, there's a lot of different pathways that you can take to get to that fire. And you may want to get warm by the fire, or you may want to put out the fire. In the case of menopausal hot flashes, I think we want to put out that campfire. So you can go around to the right, you can go around to the left, you can go right through to that campfire to put it out. And when I think about all the different treatments for menopausal hot flashes, I think about the different routes that we can take. So medications that are available work on different pathways in the brain, different neurotransmitters, hormone levels directly. As we look at different treatments, we're always interested in side effects, right? And comparing side effects. And so we want treatments that are really effective for hot flashes and don't have very many side effects. And so if we can find a treatment like that, then we can alleviate women's hot flashes. They likely will be sleeping better at nighttime. It will alleviate the next day fatigue that they feel. It can even, I think, help improve their mood and concentration, right? Because we know that hot flashes interfere with mood and concentration. So I think treating hot flashes is sometimes important for women's overall health picture, right? Women say, no, I'm gonna get through this, I'll be fine, right? And then you say, hey, we have this new medication available, these NK3 antagonists. Let's try one of those and see how you do, right? And then suddenly women are no longer having those hot flashes, they're sleeping better at night, they're able to work better the next day, their overall quality of life improves, then, they're gonna be happy that they've tried those treatments that are available. Some of these medications are so new that they're not yet on the market, right? And so we're continually watching for these new treatments to be available clinically for healthcare providers to be able to prescribe them to women. We also have a self-help clinical hypnosis program that's available, and that's something that women can teach themselves how to do. They introduce cooling thoughts, and it actually can change not just a woman's perception of the hot flashes, but how many hot flashes she has at a physiological level. Those are all treatments that are recommended. And then there's some treatments that are recommended with caution. There's actually a small surgical technique that can be done that's called a stellate ganglion block, where a needle gets inserted near a woman's neck, and it stops the feeling of sweating and the vasodilation that occurs that causes the flushing with a hot flash. And then there's some soy protein derivatives that are showing some promise for hot flashes. And we have a new medication that's been really exciting, and it works on a different channel in the brain than the antidepressants. It works on something called the KNDY neurons. And that's a totally different treatment for hot flashes than what's been currently available. There's a host of things from prescription medications that are hormones, non-hormones, and then self-help things that women can do. We are seeing a lot more cooling devices for women. There's pillows and neck wraps and all kinds of things, and those certainly provide a degree of comfort for women. And I think if they make women more comfortable, it may be worth a try for women to use. The device that we're gaining some research on is a little wrist-worn device. And that's based on science that shows that we have thermoreceptors in our wrists. And I think we know this, right? We know if we put a cool cloth or run our wrists under cool water, it tends to cool off our entire body. The wrist cooling device was developed by some folks at Massachusetts Institute of Technology, and it's showing a lot of promise for helping women feel more control over their hot flashes and help them manage their hot flashes. It also helps women perceive that the entire room is cooler, which I think is really important, because when you have a hot flash, it's an internal sensation, right? It's an inside job, as one of my colleagues likes to say. And so it's hard to get that cool relief without sticking your head in a freezer, going outside on a cold winter's day. And so being able to push a little button on your wrist and suddenly perceive that the room is 4 or 5 degrees cooler can really be helpful for women. And again, I think research will let us know if they really affect women physiologically, or if they're simply giving them a better method to feel like they have some control over their life. I think either way, they could be really useful for women.
Our next guest, Edwidge Thomas, is 60 years old and is a nurse practitioner who lives and practices in New York City. She was born in Haiti and raised and educated in the U.S. Edwidge shared her personal observations about alternative menopausal treatments and therapies that she's been using to alleviate her menopausal symptoms.
Yeah, there's so many alternatives out there for that's been marketed for women to help with managing the hot flashes. But I can tell you that from what I understand is that there's black cohosh and there's, all sorts of supplements out there that are marketed for that. I've tried one particular supplement very recently, and I didn't find it to be effective in any way. It was a very, very large pill. It was 2 pills in the morning, 2 pills at night. And I thought, I'm already someone that don't love taking pills. So that's definitely not an option for me. Exercise, I find, has always been very helpful, except for when it's hot and humid out. That's the one thing. I cannot handle hot and humid exercising. But any other time, I do find that exercise really helps me sort of manage the flashes. Specifically, I think it's also helped me with sleep as well. But trying any other supplements out there, I've not done that. I have recently purchased this thermoregulator watch that I was told about that has the same effect as putting a cold compress on your wrist, or potentially in the back of your neck, or on your chest. That has been proven to sort of either blunt or slow down the hot flashes. And this particular watch that I've used, I find at times have been effective.
Our next guest, Joyce Moy, is an Asian American Pacific Islander and a resident of Hawaii. Joyce is 75 years old and is retired. At the age of 36, Joyce had an emergency hysterectomy that caused her to go into early menopause. Unfortunately for Joyce, she found out that she's allergic to synthetic hormones. So not only did she go through her menopause transition earlier than most women, but she did so without the aid of hormone replacement therapy.
All the medication that I'm currently taking is to combat my diabetes, my high blood pressure, all that stuff that hits you when you get older. So I notice I'm getting a little bit arthritis here and there, but I haven't discussed that with my doctor yet. He wanted me to take a bone density test, which I've not done because I'm so concentrating on, every morning taking your blood pressure, your blood sugar, and all that. I mean, I'm like a pin cushion because I do it 3 times a day. So all the other medication, no. Doctor has not even, his concentration is my well-being with my being diabetic and not having another stroke.
Our next guest, Samantha Lamarr, is a 48-year-old mother of 9 who lives in the Midwest. Sam began her menopausal transition at 45. She talked openly about the methods and treatments she's been using to alleviate her menopausal symptoms. Like Joyce, Sam has chosen to take a more natural approach at this phase in her menopause transition. And like Edwidge, Sam uses nutrition and exercise as her primary remedies to ease her symptoms.
The only medication that I was offered that for one of the symptoms, which was the depression, was an antidepressant. I can't remember which one it was, but I didn't take it. I was going to, and I went to the pharmacy to pick it up, and they didn't have it in, so I thought that was a sign maybe I shouldn't take it, so I went a different route. I probably would have benefited from it at the time, but I just didn't do it. So my day-to-day schedule, what I like to do, an ideal day, and it's not every day, is to get in a workout, whether it's cardio or lifting weights. My primary workouts are lifting weights because lean muscle is really good for blood flow, which is very helpful with the symptoms, and that helps with the mental health. On days that I'm feeling the anxiety and the heaviness, I will force myself to go do cardio. If I don't do cardio, then the kids and anyone else around me is going to deal with an unhappy person. So that's what I do, and even if it takes two cardio workouts a day to get out of that headspace, I will do that. So about 3 to 4 workouts a week, and then when I'm working as a flexologist, I'm very active, physically active in that, so that's been really helpful too. I do take a nutritional supplement that's soy-based, and once I started bringing that into my diet, that made a huge difference as well. The night sweats have almost been obsolete. I mean, they're fewer and farther between since I started taking these supplements. Diet, I try to eat healthy anyway, but I like to make sure I have plenty of protein and good carbohydrates, high fiber foods. But I don't eliminate anything from my diet. There's no bad food, so I do enjoy chocolate when I'm craving chocolate, and wine when I want wine. So I know enough to know that when I am having a rough day because of the hormones, that I won't try to deny myself certain treats and pleasures.
We've spent this segment learning from our experts and guests about the various methods and treatments that are used to alleviate a woman's symptoms of menopause, especially hot flashes. When it comes to understanding this transition in a woman's life, our goal is to help our audience have a better understanding of what menopause is, and we hope to help women make better choices when it comes to the management of their symptoms and overall physical and behavioral health through this stage in their lives. We'd like to thank our experts and guests who contributed to this series. And we appreciate you, the audience, for tuning in and following This Is Not My Mother's Menopause, what you don't know about menopause, hot flashes, and night sweats. Be sure to follow us on social media, and for more information, you can visit our website, Menoinfo.health.